And welcome back to The Factor Uncensored. This next discussion is important for all of us, especially families with children who may have special needs. There's multiple developmental conditions some children can have, including ADHD, cerebral palsy, and autism. Tonight we ask how parents, or should parents, teachers, and caregivers address children with special needs here in our community? Should there be extra special attention or treatment, or treat them rather like everyone else? Our next guests have children with special needs. They're now adults. Both are 31. They're children. Joining us now to talk about it, parents Patty Deaton and Melissa Moran Garcia. Glad to have you here on The Factor Uncensored. So Patty, in the beginning, when your 31-year-old was a child, were you afraid to send them into the public, into the world, and how the world would respond in kind?
Of course. We were very concerned because she was so delayed. She had a lot of health issues. So I actually kept her back because she wasn't able to talk and she wasn't potty trained. So I kept her out of school and kept her in daycare because I had to work. And
did you feel any guilt at all as a mother, or you knew that was the right thing I needed to do at that time?
At that time I did, because I was listening to the doctors and they were saying, you need to protect her, she's not going to be able to do much. So we did, we protected her as much, and then the doctor, another doctor was saying, get her out there. That's the only way she's going to learn. She's hanging around babies. She's going to learn like a baby. If you put her with her own peers, she's going to develop. And that's what happened. She started developing more. And so it was hard to let her go because she was still nonverbal and she still had issues. And the protective mama in me, I didn't want to do that. But you have to let them take that step. You have to release them so that they can learn on their own and learn from their peers, developing and everything like that. And by the time she was third grade, she was saying full sentences. Because when she went to kindergarten, she was not saying a word. We were lucky if she could say one word.
And Melissa, how, and you were nodding your head when Patty was talking, how difficult is it to receive those mixed messages from doctors saying you should keep her in or you should keep him in, and others saying you need to get them out there? Do you get confused with those mixed messages?
It's very confusing and it's difficult because, as Patty said, as a parent, you want to be protective and you want to listen to the doctors. You feel like they know what is right for your child, but you have to put them out there. You have to let them learn. You have to let them be around their peers and treat them as normal as possible. My daughter, luckily, she had cousins and she had an older brother, so she did learn from them. But we put her in school at the right age. We started her at early intervention. It helped her out. You know, you hear doctors say they may not walk at a certain age. Don't expect them to talk. Don't expect. So it's very hard when you hear that. You know, then you think that they're not going to be able to do it. But if you push them and you let them get out there and go with their peers and treat them normal and give them the help that they need, they will learn and they will succeed.
And Patty, were you nervous when you sent your daughter first out there in the world without you?
Oh yes, definitely.
What are you doing now? What are you doing now?
Well, me and my husband went around the elementary school checking up on her. I was literally stalking, but it broke my heart because I saw her playing by herself.
But were you also proud?
At that time, I wasn't. I was nervous because she wasn't accepted. And then I had to pursue the school and say, this is my daughter. I had to let them know, this is my daughter, this is her challenges. What can you do for me? And that's when they put her in the proper school that accepted special needs. And that's when it took off, because these individuals, the kids that go to that school, are used to special needs and they treated them well. But when you're in a school that has very few, the kids ignore them.
And Melissa, the best advice for people out there who are trying to decide, how do I treat someone who may be a special needs child or special needs adult? What would be your advice to them as a parent?
Treat them as a normal person.
Yes.
They want to be treated, they want to be accepted. They can socialize, they can work, they can do everything that anybody that does not have a disability, that they can do it, just at a slower pace.
And Patty, your advice in the last 30 seconds.
Quit listening to the people that are telling them you can't do something. Show them that you can do something. There's so many talented individuals out there, and they are gifted. Everyone's gifted. They just open their gifts at different times in their life.
All right.
That is
Thank
true.
you. Thank you, parents, for joining us.
Thank you.
Ladies, here on The Factor on